The other thing about researching PFS in rats is it's hard to get an insight into the psychiatric well-being of a rat. And there's also no standard definition. So it's similar to studying PCOS in rats, but even a bit harder, or similar to studying maybe fibromyalgia in rats, which is pretty difficult.
So now, I guess post-finasteride syndrome as a condition, it's not homogeneous. You have some people that say they got just chronically dry skin. Other people say they just lost their libido. Other people, it's just only erectile function. They still have the drive, but their libido is just, or their function is just gone. They don't get erections anymore. Haven't had an erection in a year. There's all sorts of different experiences that people have. There's some research that they've tried to do in rats and mice, and this isn't necessarily translatable because in humans, the finasteride is very selective for type 2. In mice, it has about an equal affinity for both of those isoenzymes in mice. I don't know if mice have a type 3 or not, if that's been studied, but at least for types 1 and 2, it's a pretty even split. Whereas in humans, type 2 is where finasteride is working much, much more potently.
The other thing about researching PFS in rats is it's hard to get an insight into the psychiatric well-being of a rat. And there's also no standard definition. So it's similar to studying PCOS in rats, but even a bit harder, or similar to studying maybe fibromyalgia in rats, which is pretty difficult.
Mm-hmm. Yeah. And I think you even, there's a continuum of, a normal libido and sexual function decline that can happen over the lifespan. And part of that is people getting more self-control, obviously at 28 compared to 18. Hopefully you have a similar libido, but more self-control. So it may feel like your libido is a bit lower. Also, you pose this question, does having a slightly lower libido at 55 than 25 mean that you have a post-finasteride syndrome if you took finasteride? You may have that lower libido later in life, but it's not necessarily the finasteride that has done that. And there's people that have had a paradoxical reaction where they take finasteride and they're like, wow, this gives me more libido. Mm-hmm. It's hard to explain why that happens, but it's certainly not the case for everyone to expect a drop in libido. Most people don't even realize they're taking it, other than 6 months down the line, 12 months down the line, they notice, hey, I'm shedding less hair. My hair is thickening up if you're starting young enough, and you're seeing the positives of it.
Yeah, as I've mentioned in previous podcasts, after we had my youngest son, I did an experiment during the postpartum period, which in general you want at least 6 weeks of pelvic rest across the board, where I took saw palmetto 3 times a day, finasteride 1 milligram twice a day, and dutasteride 0.5 mgs once a day. And I did this for about 6 weeks. And unfortunately, I experienced no drop in libido. I did have slightly better skin. And my 5-alpha reductase exposure and the other various things that I've done in my regimen, which we'll talk about in a different podcast, I certainly had a benefit with the quality and quantity of my hair, which is not a toupee, by the way, but thank you for the commenters that think that I have a hair system. No experience personally, but also, as I've mentioned, I have very few CAG repeats, although that doesn't necessarily seem to extremely closely align, but that is my experience.
Yeah, and now if we go to the package inserts for, we actually have Propecia, which is 1 milligram finasteride. We have Proscar, which is 5 milligram finasteride. And then we have Avodart, which is 0.5 milligram dutasteride. And just kind of go down these percentages. Decreased libido in Propecia, 1.8% in finasteride, 1.3% in the placebo. Erectile dysfunction, 1.3% in finasteride, 0.7% in placebo. So very low absolute percentages. And if you're taking the 1 milligram of finasteride, it's probably because you're losing your hair, not because you have an enlarged prostate and you have to pee every 30 minutes or you're getting up 7 times a night. These are probably going to be a slightly healthier cohort, which explains some of the figures that we might see for the 5 milligram dose.
One of the other parameters was ejaculation disorder, specifically decreased volume, and it was about 1.2% versus 0.7% in placebo. One thing that's not unusual to note, more so with dutasteride than finasteride, is very watery semen. So it's not, it's clear colored. It's not unusual to see. It's more liquid-like. So that is, they didn't study it in this adverse effect area, but I bet that incidence is much higher.
Yeah, and that may not be distressing to every person. Some people are going to notice this and sort of have a freak out moment if it's not made aware to them.
Yep, you
Other
should
people,
expect it.
They expect it. It's like, okay, this is no big deal. I know that my sperm count is maybe dropping a little bit, but everything is still functioning as it should be.
Yep.
So I'm going to go to the, this is actually one of the highest percentages we've seen in a big trial. 5 milligrams of finasteride, 8.1% impotence, year one, and then placebo, 3.7%. So about a twofold increase. So a lot of these guys are getting erectile dysfunction due to what is the other risk factors. If you have BPH, like we talked about earlier, you're likely to be insulin resistant, have endothelial dysfunction, high blood pressure, all these sorts of things that come along with it.
And that was year one. Interestingly, in year 2, 3, and 4, the incidence of impotence was 5.1% in both the Proscar and placebo group.
Identical, yeah, for both impotence and decreased libido. So you go to year one for libido, 6.4% finasteride, 3.4% placebo. So again, not quite double, but pretty close. And then years 2, 3, and 4, identical, 2.6%, 2.6%. So this sort of points to, I think it's a dropout effect where people that are having adverse effects are going to drop out, or perhaps it's an adjustment period where, like with finasteride, when someone first starts taking it, they get a sort of transient dip in sperm count, and then you actually make some degree of recovery. The body sort of figures out how to work around the lower DHT. Maybe it's that spike in testosterone. You probably have significantly higher intratesticular testosterone being on a 5-alpha reductase inhibitor. So it's kind of interesting. You see this transient dip and then a recovery, at least with finasteride in terms of sperm count.
If you cut the vodka out of your androgen pool and instead you become more sensitized to weaker androgens, weaker alcohols, then you can learn to have a similar effect at the receptor level as far as density with weaker androgens. So the other thing that looked like it had a durable effect is breast enlargement and tenderness. And that had a pretty low incidence of 0.5 and 0.4 respectively for finasteride, and then 0.1 in placebo. And then it actually increased in placebo group to 1.1 and 0.3, and then 1.8 and 0.7 in years 2, 3, and 4.
Yeah, and this is where your androgen sensitivity is going to come into play. The CAG repeats we talked about. And for some folks, they may be less sensitive to androgens. So when they lose that DHT signaling, just the testosterone alone isn't enough if they're sensitive to estradiol to oppose that growth in the mammary tissue. And there are some SERMs and medications you can use to push back against that. And it depends on how distressing that side effect is to the patient.
That's a good summary. The next table is adverse reaction chart for dutasteride, which is Avodart.
Yeah, and this one, it actually stratified these into 6-month time periods, which is kind of neat to see a little slice of the study. So impotence, so erectile dysfunction, 4.7% in dutasteride, 1.7% in placebo. And this is the first 6 months.
And I believe this is the normal dosing, which is 0.5 per day.
Daily, correct.
Which, compared to finasteride, I would consider that a much stronger dose, given that what we consider the normal dose of dutasteride for hair loss prevention is something like 0.5 twice a week, or even once a week. But the normal dose of finasteride for hair loss is likely something like 0.5 per day. So it's interesting to see a much lower impotence rate at month 0 to 6, 4.7% versus 1.7. And by month 7 to 12, it was actually less, not statistically significant, but it was only 1.4, where placebo had 1.5. So this is this adverse reaction chart looks really good for dutasteride.
Yeah, it does. I mean, you're dropping finasteride. The most inhibition you'll ever get is about 70% of DHT. Dutasteride, you can approach 90, even 95%, depending on the dosing. So it's much more DHT lowering. And then this is also treating the same condition. So you'd imagine there's similar cohorts.
Yep.
Now, we can't say that, oh, there's this many diabetics in this one. We don't have the data scientists to kind of tease out those things and go back and look at these thousands of patients. But it's reassuring for dutasteride. And you see sort of this, I don't know if this is the sort of dropout phenomenon or a tolerance again, but you see the numbers as the months went on. Started off with a little over 2,000 patients, ended up with about 1,600 in both groups. So you actually see looks like a similar dropout in the placebo group as well. So it doesn't look like it's just people that are quitting the drug because it's causing side effects.
Yeah. And given the incidence of low testosterone, you'd think that more than 5% of these individuals have hypogonadal levels of testosterone to start.
Yeah. So I'm not surprised at all if you're blindly giving dutasteride and high doses of finasteride to aging males with BPH. I'm not surprised that 3 to 8% of them are going to get some sort of sexual dysfunction. Now, does that mean it's permanent sexual dysfunction? That answer is pretty clearly no. Like whenever you withdraw that medication, especially if it's for a short period of time, then you're very likely to go back to your baseline state. May take a week, may take 2 weeks, especially depending on the half-life of the dutasteride that's in your system. But my advice for people who are taking this and experiencing something like that, don't continue taking the medication. You don't want to deprive yourself of your net androgens for a long period of time. Those are some of, anecdotally the cases that we've seen where they are, having persistent symptoms and then sort of having a slow recovery. It's almost like a post-androgen deprivation syndrome where they've deprived themselves. And now you're basically getting all the androgen receptors and getting things back online as these levels return to normal or, are brought back up to a normal level manually.
Yeah, I think that's the best analogy, as we know quite a bit about post-androgen deprivation therapy syndrome or post-ADT. For some individuals, it seems to be quite similar. And then for some, not so much. But as you mentioned, we don't know the baseline health status. If they have symptoms after they stop, then it's hard to say, especially if they took it for 20 years until they're 65. How's their endothelial function? How's their glycocalyx? How's the arteries, the perineal arteries?
Is that your diabetic neuropathy, or is that the finasteride that did that?
Is that high Lp(a)?
Yeah, high Lp(a), another hidden cause of erectile dysfunction.
Yeah.